patient should expect naturalness from the first operation. We tell patients that they can be natural with one operation. They can't usually be dense, however, with one operation. And I feel that naturalness is number one. If it isn't natural, it's a bad hair transplant. So naturalness is number one. Density is a secondary issue. It depends upon how much donor hair there is, how big an area that's going to be covered. But certainly someone who has a moderate amount of baldness with good donor area can have dense coverage if they want it.